So last time the measurement was 1.5 centimeters, and now it's 0.6 centimeters. So that's more than half that it reduced in size. Isn't that great? Coming to wound care is definitely a process. Usually we let them know on the first visit that the physician is going to want to see them on a weekly basis. That's how we track the progress, make sure that the treatment that we're using is working properly. So 0.6. And when they come every week, we can assess the wound, we can do measurements, we can test for infection, we can see if there's any other testing that needs to be done that we haven't done yet.
Wound care is indeed a specialty. It is a comprehensive, robust system of how we're going to look at the patient. Do they have any other health problems that go along with the wound? Are they diabetic? We have people with vascular disease that come in, so you're not just treating the wound, okay? You're treating the whole person. So we need to understand their whole medical history, what kind of medications they're on. So a lot goes into treating that little cut or whatever wound they might have. The demographics that we treat can range from 18 years all the way up to, I think our oldest patient was 103. So it really it varies. So you don't know who's going to walk in the door and what they're going to walk in the door with.
So normally you hurt yourself, you throw some Neosporin on and a Band-Aid, and then 30 days later you realize this is getting worse or it's not doing anything. So that's when you come to us and we can find out exactly what the problem is. Is it a circulation problem? Is there an infection that needs to be treated? Is there a special topical treatment that we need to do? Is there swelling that's contributing to the wound not healing? Those are things that we look at that a lot of like primary care or such doctors they don't know that that's the route that we take.
That little ulcer that's on your foot, there's so many other things that we have to do to heal it. We have to offload it, we might cast it, so the patient's like, wow, I have this little tiny ulcer on the bottom of my foot, but I'm getting a cast put on. Why are we doing this? So we kind of have to educate them and explain what goes all into it and what they need to do from their side to heal it. We have a great group of nurses here. They are wonderful. They are really passionate about what they do.
We all work together great. A lot of the patients know us by name, and we know them by name. We know their families, they know our families. So
we got a whole wide array of different skill levels, but all of the nurses are wound care trained, and they continue their education. We promote continuing education, so we stay up to date on evidence-based practice.
So we're always learning together. Physicians, nurses, patients, the case managers, we're always learning and finding new ways to improve nursing, especially wound care.
It takes a long time to heal a wound sometimes. Sometimes they'll be treated in a couple weeks and they'll be done and they'll be grateful they're done. They don't have to come here anymore. A lot goes on the patient's shoulders as far as healing the wound. They have to keep their legs elevated 30 minutes a day, 4 times a day. They have to wear a cast or wear a special offloading device to treat the wound. So what they do will dictate how long their wound is going to take to heal as well.
It's nice to be here and kind of see patients on a weekly basis and see results actually. See people heal and see people leave with a smile and everything's good.
Wound care is a totally different nursing field. You're having patients come in and you're seeing them every week. You're building that relationship and that trust, and it's a great place to really build nursing skills.
You always see something new here, so it's a great opportunity.